Okay, Chair, you're live on YouTube whenever you're ready.
Good morning, everyone. Welcome to the Adult Social Care and Services Scrutiny Panel March meeting. We'll just go straight onto the agenda. Item number 1, have we got any apologies for absence? Chris, please.
Yes, Chair. We've received apologies from Councillors Davison and Walker.
Thank you. Any declarations of any interest from anyone? Can't see anybody. So we'll move on to number 3. Minutes of the last meeting held on the 2nd of March. Can the members agree that these are correct, please?
Great.
Can we have a seconder? Did you say yes, Teresa? Thank you, Teresa. Right, we're going to item number 4, which is Eric, the Director of Adult Social Care and Health Integration Chairperson. Eric, will you just provide us with an update, please?
Thank you. I think your introduction for me is probably longer than today's update. I think that the ICS or the integration update, I think, has been a long-standing item here. And I think when it arrived originally, it was intended to be used when there was something tangible to update on. I think obviously the discussions that we've been having recently around integration have centred on the integrated care system and the move towards that. I think probably since the last time we met as a group chair, there probably isn't a great deal structurally that I want to update on. I think what I do want people to be aware of is there is a terrific amount of work on the operational elements of it that's going away in the background. So, for instance, one of the things that we need to do is consider operationally how we will look at, for instance, continuing healthcare, which is the decision-making process about when an individual's support package is funded through local authority and when it's funded through an NHS responsibility, and how we negotiate the boundary of that. And we have across the footprint of the overall ICS, we have a number of ways of doing that. So at the minute, there are various draft papers out for consultation amongst our officers about how we would operationalise some of that decision making going forward. And continuing healthcare is just one example of that. We've also got discussions going on about something called Section 117, which is aftercare, which is about our responsibilities for people who have been in hospital under a Section 3. And again, that's a shared local authority and health responsibility. So there's a number of these kind of technical things that are in discussion at the minute, alongside housing, workforce issues, whatever. So the various subgroups continue to work away on that. The Chief Executive Officer designate for the, in fact, she's now taken up the role, I should say, Sam Allen met with my opposite number from Stockton a couple of weeks ago. Anne Workman is she was representing the Northeast ADAS group, the Directors Association. She met with Sam Allen, and there's been an invite gone to Sam to come along to one of our next ADAS meetings. So I will have more to update probably at the next meeting, Chair, and hopefully we'll have had a chance to talk to the Chief Executive from the ICS by then, and I'll perhaps be able to update a little bit more on some of the operational work that's gone on. But it's moving ahead, and I think we're more in agreement than in dispute generally when we're discussing things. But that's probably all that I need to say at the minute. Thank you.
Thank you, Eric. Anybody, any questions for Eric? Just briefly, Eric, the COVID situation, I read in the paper the other day, they say 1 in 16 people in the UK are supposedly have COVID at the moment. What's your thoughts on that?
You do like to ask a big question just when you. I think, I mean, the NHS is still under remarkable pressure, isn't it? I've heard various pieces over the last few days from medical consultants talking from various hospital trusts around the country, and they're reflecting a system that's still under intense pressure. They're not seeing the rate of serious illness that we saw early on in the pandemic, which is great. That's undoubtedly progress. But there are still people who are dying because of COVID, and we do seem to be in a really uncomfortable territory, I think, as far as I'm concerned at the minute, that You know, as I go about my business, I don't see many people wearing masks in public spaces. People do seem to be kind of returning to normal, and yet we've got this really high level of circulation within our communities of what is, you know, but I think by any sensible estimate, still a dangerous illness. So I am a little bit bewildered, if I'm really honest. I think that our arrangements around testing nationally and seem to be a bit fragmented at the minute. I know that we're in a situation at the minute where we're really a little bit unclear about what provision is going to be made for testing for some of our staff. You know, as an organisation, we have a commitment to providing testing for our staff, where it's a sort of lateral flow testing, where operationally that's a necessity because of the environment that they're working in. But we're still, the guidance for that is, you know, as far as I'm aware, is still outstanding. There's still all sorts of question marks around that. So it feels a bit, it feels a bit scattered at the minute. So I remain, I mean, by nature, I look serious, you know. I remain really worried. I think probably because it feels like a time of uncertainty at the minute. I could probably go on talking for a while, but I'm not sure I'd add much that was tangible. I think, you know, it's really unfortunate we've got such a high level of circulation of what's fundamentally a dangerous illness in our communities. And I think it feels like societally we're focusing on that less than personally I think we should be focusing on it. That's my sense of it.
Thank you, Eric. Anyone, any questions for Eric? Right, Eric, thank you very much. You can go if you please.
Well, that's kind, Chair. That would be really helpful. So thank you very much for your time, folks. Bye-bye.
Thanks again for attending, Eric.
Not at all.
Yeah. Item number 5 now, which is the role of the voluntary and community sector, which is a VCS in supporting adult social care with a focus on COVID-19 recovery. At the request of members at the last meeting, representatives from VCS organisations have been invited to attend to provide the scrutiny panel with information regarding their experience of working through COVID-19 pandemic. The work undertaken was the local authority and potential next steps for a recovery phase. Today, I'd like to welcome Kim May from Streets Ahead and Jennifer Bryson from Regional Service Manager of Recovery Connections. I'll invite you first, Kim, if you don't mind. Can you briefly tell us what you do? And then any members would like to ask Kim any questions afterwards, they're very welcome. Thank you, Kim.
Hello, everybody. Excuse me if my brain's a bit fuddled, but it's my first day back after holiday. And it was interesting what was just being said about things getting back to normal. I did a flight out and I had to wear a mask for 9 hours. And that was dreadful. Came back, got on the plane. First thing they said was no masks needed. But that felt strange as well. So it's that strange. I think we're in that strange land where nobody quite knows what back to normal really means or feels comfortable with. What I do at Streets Ahead for Information, which is on Parliament Road, is we're sort of a one-stop shop for residents. Whatever residents want, we're there to do. We're working now as a result of COVID with partners much closer. The needs of residents have become much more complex. We're now, well, I've been on holiday, now we're going to come back and start planning on what we do to help people overcome the financial crisis that's going to hit everybody, because the number of people out there who don't know what's coming is amazing. But that's another issue. Being part of the COVID Champions Network has been a vital part of allowing us to address COVID in our community. It's allowed us with a network of people who don't normally talk to each other. Everybody thinks that the VCS is this nice, happy little group that gets together every so often, but we don't. And this has actually been something that's actually made us come together and to share information. And that has been really, really useful. We've still got the hard to reach groups, which I think is where the VCS sector comes in, and that's our strength. We've held some we've held 2 vaccination sessions here, and the people who came were people who would never have got onto the vaccination bus, would never have gone into the hub, but they know where we are, they know what's going on, and they were more than happy to come in and have the jab. So it was good, and we've actually had people coming back and saying, okay, I need my second one, where can I have that? And fortunately, we might be able to get something back on that and pick people up wherever we can. I mean, even if we get 2 people through the door, it's 2 people who we've actually reached who wouldn't have been reached before. We've had various chunks of money from the COVID Champions pot of money, I suppose. Our sustainability project was linked into providing people with tablets, because everybody says, oh, well, we do everything's electronic. If you could actually walk and talk to people in my ward, you'd find, which is Gresham and Newport, you'd find that most people don't have connectivity to the internet. They don't want it. My ex-chair didn't. If she wanted a holiday booking, she didn't go online and do it. She came and asked me to do it for her. And that's what we have. We have people who either don't want to do it, or don't know how to do it, or don't have the accessibility to do it. We've all got mobile phones, yes, but do we have the broadband width on there to actually to do it? I mean, my eyesight's not fantastic. It's not bad, but open something on my phone and I'm stuck. I just can't get it to the size I'm comfortable with. We actually also employed a reach out officer whose job was to actually go and knock on doors, go into Tesco, check that people were okay. And this was sort of as we're coming out the first lockdown. People took to their homes and they didn't come back out again. And we've been working gradually since last June really, to get people to actually come back out and start integrating into the community. Our biggest success, I think, was our COVID flyer. We had a newsletter which we also put on IT electronically prior to COVID, and then we discovered, well, we're not getting to people. So when the COVID-19 money came around, we actually started to produce that in a paper format, and we deliver it to every home in the Newport area, which is 3,500 homes. It's not cheap. It's a nice colour. It's usually 4-page. Sometimes it's 8-page because we work closely with locality. And if they need to put something in there, it's acknowledged as a way of getting to everybody. The language barrier is another issue, but that's something else. On top of the Streetwise, we then decided to apply for funding for a COVID flyer, and that was purely on COVID. It had nothing else on it, but it told people when the vaccination centres were happening, what you needed to do, what you couldn't. When it first started, what were the regulations? Could you go out? Couldn't you go out? Could you go to the shop? Reminding people if they needed help picking up their shopping or the medication, just to give us a ring. And it really did establish us as being the place to come if you wanted to know anything about COVID. And then the COVID Champions Network helped us, because we didn't know all the answers, but it allowed us to find out where the answers were. As part of that, we also set up a community connectors group. We were going to do it just as COVID set up or blew up, and it didn't work because people weren't coming out and weren't talking to people. But community connectors is like, I call it a spider's web, and we have about a dozen people who we can contact either by email or by telephone, and they link it to 6 more people, and then they tell 6 more people. And I said, it is like a spider's web. We're getting to places where nobody else can get. And it stops a lot of the, oh, well, Mrs. So-and-so told me on the street corner that this is what needs to be happening. We're actually getting the real information out there rather than the fake or the made up information. We tell people what was actually happening rather than what they would like to think was happening. And that's still growing, and that's really working really well. But I think that's what the issue is now, is that helping people get back to normal, or whatever their back to normal is going to be. We're working closely with public health now. We've got a project with public health about sort of how we do that. That has only just started, so I can't really give any feedback on what direction that's taking at the moment. But I think that the focus has moved now. People have thought that we've gone back to normal, so therefore vaccination is no longer an issue, and that there's been no push on vaccinations. before I went away, I noticed that on TV, everything on COVID was open your windows, open the door, do this, do that. The public health measures it was going on. Vaccination message seems to have really taken a back step, a huge back step. But if we want to live with COVID, then I think the vaccination is what we need to be doing. And I think that's where the VCS comes in, because we can actually get to the homes that nobody else can get to. And I think that's about it, really. There's probably all sorts of stuff that we do, and I've just forgotten what it is. But if anybody wants to ask me any questions, then I'm more than happy to answer them.
Thank you, Kim. You do a fantastic job by the sound of it. Can I ask you, when you say how do you help people with financial problems? Is it just advice, or do you have money you can give them?
We don't have money that we can give them. We actually have an advice drop-in centre. The welfare rights come in, and it's actually SAC that come in and do it for us every Tuesday. So we have appointments are made. We're now looking at how we can actually set up some sort of referral service. Our next edition of Streetwise is going to be about, we'll have a major focus on what to do about your utility bills, and so to get people to come in so we can actually work with them to look at, are they on the best rates possible? Is now the time to switch? Money Saving Expert has got all sorts of information there, but again, people don't know how to access it or where to access it, and that's what we'll be doing over the next 3 to 6 months.
Thank you. Right, can I ask any members? Yes, Denise, you'd like to come in?
Thanks, Chair. Hi, Kim.
Yeah.
Yeah, right.
Yeah.
A couple of questions. One, you referred to language barriers. How difficult is that, and what support and help do you get? And what more could be done? And I think you've touched on some of these issues already, but maybe something about the lessons learned over the last few months or year, 18 months really, isn't it? Anything that you've learned that you would do differently? Thanks.
The language barrier, we hold ESOL classes here, so wherever possible, we try and make that link in. But during COVID, we didn't have that happening. We had our ESOL classes were being done sort of via WhatsApp groups and YouTube and whatever. We link very closely into George Jura, because a large part of our population that's not vaccinated is our Eastern European population. So George provides us with help and support from his CIC, and we're sort of working very closely with George on that. It's quite difficult with the Eastern European community, because with a lot of the Asian communities, there's community leaders, and you can link into the community leaders. With the Eastern European population, that there's not that same sort of structure. There's the churches, and that's where we're chipping away, trying to get into the churches to actually get the vaccination and that sort of message out there. And also, we'll take help from wherever we can get it. We always say we're not proud. We'll give anybody a smile who can actually help us. There's lots of people out there saying, "Oh, you can't do this and you can't do that," but yes, you can. And because we are our own charity, we can take that step that somebody else who is funded differently couldn't. So we're working very closely. Lessons learned is, yeah, you do have to take help from wherever you can get it. If you sort of see there's a need, you've got to step to it. I mean, when the first lockdown came around, the idea was that we closed the doors and we walked away. Well, that happened for 3 weeks. And then I was getting phone calls at home, I was getting emails. And then we opened for half a day a week. Then it was 1 day a week. Then we were basically back to full time. And all the way through, other than those 3 weeks, we've been a presence. And that's the lesson we've learned. People do get to rely on you. The lessons learned is the VCS does need to work more closely together. There's lots of things still going on out there that we don't know about. And also local authorities are guilty of this as well. They don't tell us what's happening. So if we don't know what's happening, we can't tell our community what's happening. So that's really important. I think one of the lessons learned, another lesson learned, is that to use strength of the community. This community connectors has basically, it's taken off. It's just a beast of its own. The idea was that we would be able to keep track of who was a community connector. that's not happened anymore because we just don't know. But we do know that the messages are going out there, which is the important bit. Us keeping track of it will be fantastic, but we know that it's working. And people will say to people, how do you find out about that? Oh, well, so-and-so told me. So we know the only way they've found out about it, because we've never heard from them, is that somebody in our Community Connect has told them about it. And also the power of putting things out on paper. Don't just rely on electronic versions. They don't work in all communities. The number of people who actually come in, I mean, we've got an eco shop on this morning, and that's probably some of the noise. If you can hear noise in the background, I apologise for that. But people come in and say, oh, well, found out about this out through your magazine. Say, oh, it's brilliant. People actually keep it to tell them what's happening. And we have a what's coming up in the next, we do it every 6 weeks. So what's coming up in the next 6 weeks? What's happening in the next 6 months? Vaccination buses go on there. Everything goes on there as much as we can. And there's always something that arrives 2 days after it's gone to publication. Always. But we use our Facebook page for that as well. So, you know, it's just, yeah, we just got to, you've got to be flexible in this job.
Thanks, Kim. Yeah, that was really enlightening. It's good to hear all of those things. Just to come back on one of your points, you talked about the VCS and the coordination, and you also said, I think at the beginning of your presentation, that has got a lot better than it was. So obviously its momentum has got to keep going. We've got to find a way of doing that. Are there any current forums? I know that there used to be the financial inclusion group, which is where a lot of the VCS would go, but that was around specific interests, if you like. Has there never been another forum for the Voluntary and Community Centre to just come together and share information, even if it was only a couple of times a year?
There's NVDA do a couple of things. They do their volunteer team do a group that meets, but they tend to be very much sort of just focused on one issue. Whereas there's nothing like a cup of coffee and a chat. But COVID Champions has allowed us to actually do that. And I think because it's also, I mean, one of the good things, bad things, I'm not quite sure. I'll decide. Zoom meetings, you don't have to trudge across town. But, you know, it gives you 20 minutes to get there and 20 minutes to get back. Then a meeting that lasts an hour, so it's a morning gone. And the VCS sector is we're understaffed, and that's just because of the money. We renewed our lottery funding just a year ago, and I actually asked the lottery for more funding, for more staff, and I was told, no, you can't have it, because the bigger agencies, the bigger voluntary sector, the likes of Age Concern, their shops hadn't been open, so they were coming asking for larger chunks of money. So lottery were putting money aside for that. And I was told, oh, well, come back and there'll be different pots of money. So it's a sustainability that's still a problem with VCS. Everybody's after the same pots of money, and that is a problem. But yeah, it is great to have this. And it's maybe a role for NVDA to take on board, is to actually get the VCS sector together, just to have a chat, just catch up with stuff.
Right, thanks, Kim. Can I just take further question, Chair, if that's okay? Yeah, I mean, that is all really helpful information. This is a scrutiny panel, and as such, we may or may not make recommendations from here, things to take further. Is there anything in particular you would want to say to us in doing that? Obviously, everything that you've said here today is extremely valuable.
I think the funding that's come by Middlesbrough Council for the COVID Champions Network has been valuable. It really has. I think if anything was to go forward, I think to keep that going, to keep the links going between different VCS sector groups, because we tend, I mean, I talk to people who do my type of job across the town, and there's not many of us. But we don't then link into Recovery Connections. We don't link into so and so. But that has developed over the COVID period, and that is now going forward, which is really, really good. But we need to group some sort of forum that actually brings everybody together, and any sources of funding, if it could actually get out to grassroots to the people who are like us, who can actually get into homes, get to people where they don't actually realise what we're doing. Slowly, there's more than one way to skin a rabbit, and you can actually sort of get in there and to talk to people about one issue, but really you're talking about something completely different. And that's, I think, one of the strengths that we do have, and I think that's what Middlesbrough Council should really sort of take on board.
Thanks very much, Kim. Thanks, Chair. I'll let somebody else have a go.
Thank you, Denise. Anyone else? Any questions for Kim? No, well, Kim, I'm saying funding is always a problem, isn't it, everywhere? But we appreciate, as a council, we appreciate what you do, and thank you, and keep up the good work.
Thank you, Jim. Much appreciated.
Now we'll go on to Jenny. Jenny Bryson is a Regional Service Manager of Recovery Connections. Over to you, Jennifer.
Thank you. Morning, everybody. So does everyone know, do we need a background of Recovery Connections and what we do? Would that be helpful?
If you just give us a briefly background on what you do, Jennifer, and then if we want to ask you any questions, you can answer them. Thank you.
Okay, absolutely. So Recovery Connections is the recovery element of the drug and alcohol service in Middlesbrough. We do host in other areas as well. In Middlesbrough specifically, we have a quasi-residential rehab where we have, through COVID, we actually had to reduce our bed numbers from 8 to 6 because 2 of the rooms were double rooms. And we also had a community element which used to run from the rehab building, but we had to put a closed door policy in place, and the community had to go and work from our social enterprise. So we've got rehab, community, and then we've also got the social enterprise element as well. So we've got the a cafe, an event space, and a florist, which were all closed during COVID. So our community team were able to work from there. We link in with, so at the beginning of the pandemic, we were working with contractors CGL that then went in-house to the council in April last year. And we've always worked alongside Foundations as our medical element as well. So people can come and stay with us for 6 months in our quasi-residential rehab, working a 12-step recovery programme, or they can go within our community teams where there's a multitude of offers of different programmes people can go on in order to get well. So through COVID, our rehab had to stay open, and that has been fully staffed the whole way through. We've had different plans in place to ensure that that can happen. And the community element was closed for a little while. We did go online, so we got the news of going into lockdown. 2 days later, we had a regional online timetable ready to go live. So we quickly turned that around and we were all online. Quite quickly, we weren't reaching everybody that we were able to reach. So different grants that we were able to get in allowed us to provide telephones and tablets for people to be able to join in that offer. It didn't seem to be enough, so we quite quickly started to put on groups. So it was COVID guidance at the time that we could have groups on, so they were really restricted. Everyone had to book on COVID questionnaires were asked to people the day before, and it was all really strict, but we managed to get groups back up and running. We then got a new building for our community team, and so that has been running face to face for some time, and that's been up and running as normal with guidance in place. So everyone has to wear masks, sanitising, ventilation, all of that throughout the building as well. So things have changed an awful lot. We are part of the COVID champions. Mark Eltringham is one of the COVID champions. We've been running different groups, and that has taken on its own journey really over the last 2 years. So we had COVID specific groups. We found people weren't coming. We did them online. We did them face to face. What we eventually found worked was that just having conversations with people after the groups, after normal recovery groups had taken place, that was really what worked. So people would stay back and chat to us for half an hour while we could deliver the information to them that way. So that's now how that's done. The other thing we did through COVID was, so because our social enterprise was closed, however, a lot of our communities rely on food banks and things like that, and they weren't as readily available. Our social enterprise was utilised to be able to cook meals. And I think it was about 5,000 meals we delivered to parts of our community and their friends and their families that they knew were struggling as well throughout COVID to keep them going. So that's a quick whistle stop tour. I'm not sure whether I've given you enough information, but please feel free to ask any further questions.
That's great, Jennifer. Can I ask you a couple of questions? You treat recovering addicts, obviously. Are the numbers reclining, or are they getting more in Middlesbrough at the moment?
So we are seeing, I think we work alongside our partners within the council, and they assess everybody within the council and they refer into our service. Generally, I would say that the numbers are going up, especially for alcohol use, and for people that just need short-term interventions. We're seeing that right across the region.
And your success rate, can you measure that?
I think at last look, which is probably not including or maybe only the beginning part of COVID, I think the residential rehab was 55%, which is very similar to other rehabs in the area. We don't have success rates within our community team. Success is really determined by the people that we support, so it's really difficult to try and assess success rate. But we have implemented through COVID a new system to be able to try and gather that some of that information so that we can provide data on how people's lives have improved rather than whether it was a success or not. So that's a new system that's just up and running.
Great, thank you. Anyone, any questions? Denise? Yes, go ahead, Denise.
Thanks. Hi, Jenny. Yeah, I mean, that was quick and very comprehensive at the same time. So thank you for that. In terms of the process that you've gone throughout COVID, were there any particular barriers that you came up against, and are the things that maybe you were doing that you won't revisit? Because you've talked about how you've adapted to be able to have people back into the buildings, you've gone along, you know, you followed the guidelines in order to maximise the use of your organisation. So is there anything within that you will maybe not go back to at all? You know, you'll change the way you work?
I think while we were still in the middle of COVID, a lot of our communities, so we're very led by the people we support. We kind of try and collaborate with our communities to put on what they tell us that they need. So in the middle of COVID, they were saying that they would always want to keep some form of online timetables. However, looking at the statistics and the figures, they dropped day on day. So Middlesbrough was probably our office that went back face to face, and the communities have adapted really well to being back face to face. So they were telling us they wanted to still do online groups, but actually the figures were showing they didn't. On further consultation, it's not something that they will want to go back to. I know a lot of people struggled with technology as well. So we were providing people with technology. We were setting up devices as much as we could for people, yet people were still struggling to be able to utilize those, get onto online groups, and it wasn't quite the same for people either. So there is evidence to say that the opposite of addiction is not recovery, but it's actually connection. And I think that human connection is really what people miss. So although we will probably try and do some kind of hybrid model, I think the face-to-face element is definitely better once we can get it up and running and established again.
Thanks for that, Jenny. I found that really interesting from both speakers, actually, because, you know, from people on the outside, we just go, oh, IT, tablets, technology, it'll connect people. And yet the evidence is showing that that's not the way forward, really. We need to go back to what people need and what people want. So thank you both for that.
Thank you, Denise. Anyone else, any questions? Well, ladies, thank you very much for your short presentation, and at least we know a bit more what you do now. And thank you for answering all the questions, and we can move on. But if you would like to leave, you're very welcome. Thank you once again for all the good work you're doing.
Thank you.
Thank you. Thank you
Bye.
both.
Thank you.
Very interesting, those two ladies, weren't they? And they do a lot of good work within the community. Right, we'll move on to item number 6, which is the role of voluntary community sector support analysis in terms of reference. Chris has put down 3 terms of reference, and we can discuss these and agree on them. The first is to understand the impact that COVID-19 has had on local communities, the local authority, VCS organisations and how services are delivered. Second one, to examine how the local authority has worked with VCS during the pandemic and how support has been provided. And thirdly, to explore effective strategies and projects to further develop support provision in a post-pandemic environment. Anybody, any questions on those? Yes, Denise, go ahead.
Yeah, I've got a couple of thoughts just based on what we've heard. If we're looking at an effective strategy, there are two things that I think we could maybe think about and explore further. One is how we support organisations to do that face-to-face contact, either in person or, as Kim expressed, through the paper route, things going into people's homes, and what support is needed there, because I think both of those things are showing real benefits. The other thing is around how the VCS can continue to work as a collective group across Middlesbrough. Now, Kim referred to the MVDA, and it might be that they can set something up, but this will have to be owned by all of the parties, not just one or two individuals, obviously. But my experience of things like this is people do come together, they do share, but it's the administration that costs, and it's the administration that takes up the time. So I think we need to look at how best we can do that. I know other authorities in the past, and I'm talking about Yorkshire authorities here, have actually funded that resource, the administration, and certainly the rooms, if there's any cost for room hire, then that's been provided. So it's the practical things that go along that. But in terms of a strategy, I'd like to see how we can support something like that coming into play. Thanks.
Totally agree with you, Denise. Chris, when we put that in, how we can support these organisations. And it's a good point you made, Denise, about bringing them all together, because there must be more than those two. And they're all trying to do the same thing, really. So it would be interesting if we could bring them all together and help them, because there's a lot of people who need support out there, and even more so with everything going up in price as well. Anyone else anything to add?
No, I just agree with what Denise said. It is important. We have tried for years to get all these people together, because you don't want to keep reinventing the wheel all the time. So I agree. We should try to help them. The financial side.
Yeah, let's push it there, Teresa, and then we'll make a point that we will do it, rather than say we will try to do it. We will do it.
Can I just add something there on the funding? One of the things Kim said, which disturbed me, was about lottery funding. She was going to the lottery and being told that the funding for this particular area was being earmarked for certain groups, which, and probably rightly so, but funding's a huge part. The lottery is it's a huge part. And I think some years ago, there was some assessment done of how much funding comes into this particular area, and it was a lot less than some of the other areas. So there's some work to be done there to be to bring that forward. Now, I don't know whether that's for this group or for another group, and maybe that's something that Chris could look at for us. But certainly getting representatives from the lottery down to talk to people, including us, because quite often they go to the voluntary sector and that excludes us, and yet we are in a position to help make things happen at times. So I would like to hear from the lottery, and I would like to know why they're not putting more resources into the Tees Valley, and to find out how that operates. But as I said, I'm not totally convinced that is this particular committee, but if I can rely on Chris to take that away and maybe explore it for us, that would be great. Thanks.
Through you, Chair.
Kim said the funding went to bigger groups, didn't she? And those bigger groups should be able to factor some money down to the smaller groups, I would have thought. Maybe not. And you're right, Denise. I mean, it must be more funding, not only just the lottery funding. So I don't know whether it's our job or not, Chris, but can we look and find out whose job it is if it isn't ours?
Yeah, it's certainly something I can look through or look at, Chair. And I suppose that kind of brings us onto the next point, really, about next steps for this review. So that's certainly something I can take on board and look at. Obviously, this is the last meeting of this municipal year, so our next meeting is going to be June. So really, I'm just interested in the panel's thoughts about if there's anybody else they'd like to hear from, or what kind of route they would like to go down. Obviously, the lottery route is one that I'll take up. Is there anything else you'd like me to look at?
Sorry, Chair, but have we looked at funding streams? I think we have, haven't we, to an element? Yeah, we've got that information.
We did at the last meeting, yeah.
Yeah, I thought we had.
Did we do anything about it? It's all right looking at it. Did we find out and do something about it?
Yeah, I don't think we'll be able to direct where the funding goes.
No.
That's something else, isn't it?
Put recommendations forward, Denise, that we recommend that the funding goes here or there. No?
No, because it relies on organisations being able to fulfil those obligations. I just wonder if there's any gaps out there, because I mean, one of the things Kim said, and also Jennifer kind of advanced on was the use of technology. And in the early days, we've spent money on technology. We've given organisations laptops and tablets and things. And I think where it went to the schools, it was very effective because that helped children learn. But for other areas, that hasn't been. So how much money have we spent on that? And should we have been directed towards something else? So if we come across this issue again, then how do we approach it, basically? And I think, for any, whether it's a pandemic or it's any other crisis, if we can look at how we respond to that in terms of making sure people are healthy. So what's it? It could be as daft as having an IT hub within the council or within, Streets Ahead. So, as Kim said, people come down and ask her to book holidays. Well, could you have an IT person there that would help people like we do in the libraries? Could that be expanded? I don't know. I'm rambling. I'm just.
The council from I think the council provided £100,000 worth of laptops to school. I seem to remember. Am I right, Chris?
Yeah, well, the schools has obviously been successful, and I think the teachers would confirm that. But when we're looking at older people, when we were expecting that they will be able to use them, and they're not, so.
We wouldn't need as much funding, obviously, Denise, as schools would, because there's more children in schools, obviously. Yeah. Graham, did you want to come in now?
Yeah, thanks, Chair. Going to back on Denise and getting the groups together so where the council can come in and help out at the same time. So, do you think we'd be looking at maybe just like a large enough office somewhere where they can come into us and sit with somebody as in IT? I was just thinking there, are we moving into Fountains Court? Wouldn't there be something big enough in there where they can actually either peppercorn it or have it for free type of thing? So we have all of them together in one room where it's sort of coming together, where we think, across the room, say, we've got this, we've got that. Can you do this? Can we do that? That type of thing. It's just a thought for Fountains Court. I don't know if that's any, again, am I rambling? I don't know.
No, I think that was the point I was making earlier on, because people will be happy to come to a meeting, although Kim said, it's a morning out. I've worked in North Yorkshire where you're talking about a day for an hour, to travel. But people do it because they want to connect with other organisations. So providing the very practical mechanisms for that, so having a room available that they can book free of charge, a set number of days a year, we could give them that. We could say, right, this particular organisation, they could then organise it from themselves from that point, and it may be that they want to hold a marketplace event, which is where, you know, the first event is about bringing along information that my organisation does, so you start sharing that, and that's something that could be open to both the public and to us as councillors, but then taking it on from there and looking at how they coordinate their services. There's always been suspicion within the voluntary sector that, you know, if I go for this funding, I don't want you to know about it because I want the funding. But we've got to move past that, and I think that's what they're doing as a group. They're seeing the benefits of working together because everybody wants to help and everybody wants that particular gap filled. So it's like, I can provide this for this particular group of people, but nobody's providing that, and that could be your job, you know. And it's about bringing all of that together, and I think if we can facilitate something, but we would need to go back to the sector and say, this is what you've told us, we'd like to take it forward. Do you think you can take it forward? Is this something that you really want to do? And you know, it's about getting them on board with that. But I think in terms of a strategy in regards to the health element of this, it's about how do we promote people's well-being and a healthy environment for them. So that would be the link for me for this particular committee.
Yeah, yeah.
I totally agree, and you made some good points there. And I think, I mean, with enough empty buildings in and around the town, that surely we can facilitate. I mean, that will bring these people together and let them use the laptops or whatever. Yeah. Anyone else?
Do we need to do anything else, Chris?
No, I think there's plenty of food for thought there. I think if we carry this over into the next municipal year, that obviously that's certainly an option. Like I say, we've got a bit of time to do a bit more research and contact some appropriate bodies to get, you know, somebody in. I mean, there's always the option to prepare a report now on the information that we've got. If you would like to tie this up, you know, year end, so to speak. But also on the flip side, I think that there's also, you know, legs, if you like, in pursuing this a little bit further, just to see what we can find. So I'm happy with either approach.
I think probably there's more work to be done.
Yeah.
Okay.
I think so.
Those two ladies today, I thought were excellent, and they're only two of the voluntary sector, aren't they? There must be loads more. So I think there's a bit more work to be done. Would the panel agree?
Yeah.
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 Okay. Okay, Chair, if you leave that with me, I'll do a bit more work on that. Okay.
Yeah, thank you, Denise, for everything you're saying, and everybody. I mean, it is important, and I say those two ladies were very impressive, and they obviously do a lot of work, a lot of good work, and other people out there to do doing a lot of good work as well. Right, we'll move on. Unless anybody anything to say before we do move on?
No.
All right, thank you. Item number 7 then, overview and scrutiny board update. The following matters were considered at the meeting on the 23rd of March. Executive forward program, the executive member update, executive member for environment and finance and governance with attendance, the chief executive's update, the chair's update, and finally the town plan update. And now we're going to item 8, which is any other business, and I have nothing, but I must say it was a good meeting today. Thank you very much for your input. Denise is always welcome. Thank you very much for everybody coming, and that's all I have to say. And thank you, Chris. You're going to put these things together for the next meeting in June.
Will do, Chair, and just to advise that I'll confirm the date of the next meeting in due course as well.
Thanks, Chris, and thanks for all your help.
Yeah.
The
No problem. I think it's been an interesting year. Good.
Yeah, and that's a good topic for next year, and there's a lot to talk about and a lot to do. Thank you for your attendance, Teresa, Graham and Denise. And
Yeah.
thank you, Chris. And that's it.
Right,
Denise,
bye.